Hello everybody, I'm going to try to do a little tutorial about how I do fit testing. I'm not wearing my shield because I want you to try to hear me as much as possible. And if I miss anything, I will try to let you guys know. So firstly, when you come into the storage closet, everything that you need for fit testing should be up on this section. We've got masks, and we even have some extra masks back there that are just like weird fitting. So if somebody really has an issue, they can try those other masks. However, most people fit into these masks that we use. We are currently using these Macrite masks. We have other ones that are on their way, but these are the ones we have. So we have the regular masks here, and then we have the second one that is here. You can see that it's small by the indication on the box. So small here, regular doesn't have the indication. Also on the mask itself, it will have a little label that either states that it's just a regular N95 or if it's a small, by the number at the bottom of the mask. On the top it says Macrite and some numbers. I know it's backwards, but it says N95 and with an S at the bottom. So what I like to do is I get my cart set up here. I get myself some Cavi wipes, some hand sanitizer for myself. This is going to be inside the box. The box is going to look like this, and it will be placed up on that shelf, but everything should be mostly inside it. It's going to come with a hood and a plastic thing. This inserts into the hood so that you can fold it down. And then it comes with these different sprays. So we have two different sprays here. We've got one that's red. So it's got a red spray here, and it's going to say this is a sensitivity solution, and it goes into the sensitivity solution red top. Now the bottoms are all the same, so you just have to clean them out between, but this one says 1, so I'm going to put the 1 in the 1, and then the black one is going to be the sweet solution. So we have that here. Again, it might be backwards for you, and I have it in the black. It's going to say number 2 here. So also real quickly here, inside every box is going to have the directions for how to use it. So if you have any questions, there is an English and a Spanish side, and most of the information that you're going to need to remind yourself how to do the fit test is going to be on page 2. It's going to say fit test right here with my fingers, and it'll go through the different testing so that if you ever need to refer back to here, it's going to be right in this book here. So before I get started, I unfortunately already filled these up to show you, but these come apart, so they just screw apart here, and then they have different settings on them. So it screws apart just like so. I already put the solution in. However, the base unscrews from here. So when you clean it off, you can clean this off here because this is just the compressor or the puffer. I actually don't know what that's called. But this part here also comes apart. This just twists off. It's a little plastic piece. This is what it allows it to make like the plume inside the student's masks. So this part is really essential, and this just goes right onto, there's like a pointy end here. It fits right on top. Now I will warn you, after a few uses, a little bit of crystals get stuck in this top portion, and it allows, you can go ahead. It makes it difficult for the aerosols to be made. So they have this little piece. I just dropped that on the floor. So let me grab that. They have this little metal piece in each box, and what you do is you insert it inside of here, and it helps relieve any, you put it right into the tip of the pointy part there, and it will help open up that airway so that you can actually puff it. It makes it so that it's really difficult to squeeze the compressor. So that's in every box, and I keep that handy. You put a little solution. You don't need too much, only because you should be cleaning these out between each use, especially the number 1 with the sensitivity, because you're actually using this in somebody's open mouth. So you just have to clean the top portions here. I've been using the Cavicide that's in the other rooms here, so when I go in there, I'll spray it down and let it rest. We have 2 sets available, so normally I have somebody will go clean it out and let that dry while I'm using the other set. So I do about the same amount in each solution, just a little bit. So we can get started. So first of all, with the masks, one thing that we have noticed, if somebody doesn't have a nose bridge, it makes it really difficult to make that seal around the nose. So I look at their face. With their face, if it's a little bit smaller and thinner, which unfortunately, like, you know, somebody who has a really round face, sometimes, you know, you can fit them in the moderate or the medium size or the regular size. Someone with a smaller petite face is going to need a smaller size. However, if somebody doesn't have a nose bridge, we do have an opportunity to put some smoothies. I have some here, and I have them already mostly kind of cut up in sections of 5, so I can put some with their masks if they need them. Now, students, however you test is the way that you have to wear the mask. So if you test with a smoothie, you have to wear the smoothie when you're wearing the mask. So I always sometimes give the students that come in with already a smoothie on their nose, I give them the option to do so. So with the masks, the metal bar is really, really sturdy. So if you were to go and bend this like a traditional mask, it would make a peak, and so you would get air through that peak. So you have to be very careful when you try to apply it. So I'm actually going to put it on to show you how I fit people's masks with nose bridges. So when I take the mask, I look at people's nose bridges, and sometimes what I've noticed is I can make my own nose bridge. So I start here and I kind of give myself a little indentation. I give myself a little indentation. And then now I have like made myself, oh, that was a terrible one. Made myself a little nose bridge. So I've noticed that this has helped me a lot too, to prevent from that peak when I just squeeze that metal bar. So when I ask anybody to put it on, I have it placed over their face, and I have them push back, not towards their nose, and to their eyeballs first, and then pinch at the top to get it so it's really formed around their nose. That's how I do. So the top strap will go around the top portion of your hair up here, and the bottom portion should be lower around your neck. Now the issue what I have found is some people, it's very loose, this lower bar, so I will sometimes bring both of them up here to make it so it's a little tighter. I also recommend people wear their buns a little bit higher, because it will hold this strap higher up on your face. So once it's on here, you apply it on, and I just take a quick look. I have patients or people put their nose down. Do I see any visual gaps here? And then I'll have them put their chin up, and sometimes you will see a gap, like you can see it in mine, how it's gapping right here. However, it doesn't necessarily that air is flowing through there, because my chin up here is sealing it better. So might have a little gap here, but it doesn't mean that it's not sealed, because my chin is sealing it. Okay, so that's first thing how I kind of get somebody in a mask. Of course, you can put the smoothie on underneath here, and we can start from there. So I'm going to get back in my traditional mask so you can hear my voice. So what we do is we first have the patient or the person come over, and let me see if I can get this so you can see a little bit better here. I don't know, it's fine. We're just doing this on a whim here. So what you have to do to start it is you take everyone's stuff from the head up. So I have them take their hairnets, even their glasses, because sometimes it makes their glasses a little sticky. So I have them take everything off, including their mask, and their mask list here. So you have the tarp on in here. You have a little hole that's facing the front. This is where you're going to stick the solution. I use this to kind of hold it down on the student's chest, just to kind of make it so it doesn't fall anyway. So I keep my finger in here. So I place that on top of the student, and then I'm going to be using the red solution. So the red solution, it tests the sensitivity. So what I asked the student to do is without it open, everyone's watching me, I'm going to have them open their mouth and stick out their tongue like so. And so what they need to do is they need to tell me when they taste the solution. So you do one spray, you have to do 10 sprays in 1 minute. And what I have found is if you do one spray every 6 seconds, that equivalents to one every 10 sprays for a minute. So we do that for the first round, and you have them tell you when you can taste the solution. Once they taste it, you can stop, and you don't have to go all the way to 10. However, if you go all the way to 10 and they don't taste anything, you have to do it for another round of 10. At that point, the student tastes it at, spray 17. So what that means is you have to double the amount of sprays that you do for your testing. Typically you do 10 sprays within 1 minute. If the student tastes it at 17, you need to do 20 sprays in 1 minute. So, and then further, if they take 30 times until they taste it, you have to do it 30 times for the testing. Sometimes what I'll do, I'll have the student leave because they've had a cup of coffee, or they just rinsed their mouth, or whatever it is. So I'll have them leave and we'll come back and we'll try it again, because sometimes once you get past 30, that's just way too much. So that's just a little hint that I do. Also, I would ask, a lot of people with coffee has changed their testing. people who have done the pre-rinses, things like that. So just ask if they're not tasting it. Maybe they just ate. Sometimes that does affect it. So I have the patient sit there, tongue out, and I spray one spray every 6 seconds. Then that test is done. Once they're done, I take the headpiece off. I put them in their newly fitted mask and get them all fitted. I put the tarp on top, or their helmet on top. Again, you can come on by. I'm doing a video for you.
Oh, yay!
Yeah. You can say hi to your own video. Okay, so I get the cover, and then I'm going to put it back over their mouth with the mask on. So then I'm going to take my second spray, which is going to be spray number 2. Enjoy that now. So I'm going to do spray number 2. So you're going to do a series of, I believe it's six different tests. Each thing that you're going to tell the student to do, they need to continue it for 1 whole minute. So the order, like I said, is going to be in this fit test section here, and it's going to be 1 through 6. Like I said, perfect. Actually, no. Yeah, 6. So the first test, you're going to have them tell you when they can smell it at this point. When they smell it, we got to stop the test and figure out where they're getting the leak. Most of the time, like I said, it's right here at the peak. Sometimes it's kind of a little bit gapping here. At that time, you need to determine if they need a smaller size or if we need to do something to accommodate. Hasn't happened that often, but it does. So the first one you do is you're going to have the student just breathe normally for 1 minute. They don't have to wait for you to spray it, nothing like that. They just have to breathe normally for 1 minute. For 1 minute after that, the student has to take deep breaths for 1 minute. After that, we're going to do a series of head moving. So we're going to ask the student to turn their head all the way to the left, take a deep breath, and then they're going to turn their head to the middle and exhale. Take a deep breath on the other side, exhale in the middle. So we're going to have them go back and forth with that repetition for 1 whole minute inside the hood, and you're going to be spraying continuously within those 10 seconds, or excuse me, within that 1 minute for 10 sprays. So we're going to have them go left and right. Then for the fourth test, we're going to have them put their chin up towards the sky, take a deep breath, head down towards their neck, exhale. Head towards the sky, take a deep breath, down towards your chest, exhale. Now do that for 1 whole minute. Then you're going to have them do speaking. So they say that they want them to be loud and vocal so that during this test, it's like they get a little bit winded, they have a lot of movement. So for 1 minute, they have to talk. So the instructions say to sing happy birthday. Sometimes I like to ask them to tell me a story or something, and I make them just continually talking for that 1 whole minute. So the last test, there's 2 ways to do it. However, we're really trying to do it with the running. We want you to run in place for 60 seconds. Now, I have a trick, and I'm just going to try to share it with you here. When it's on their chest, and you're trying to do 2 things at once, they're running, and you're trying to spray at the same time. It's hard. It's tricky. Your spray seems to fall out of the little hole right here. My biggest trick is run with your hand with it. It's kind of like a spray. So both of your hands are going to move at the same time of them running, and it really helps. But when I try to keep my hand kind of straight, it kind of flops all over the place. It seems like it would make more sense, but for some reason it took me longer to figure that out. So bounce with them with your hands, and it helps kind of keep everything in place. So they run in place for 1 whole minute, and then 1 whole minute, we're going to have them stay in place, breathe however they need to breathe after running, and then we're going to spray for 1 whole minute. So breathe normal, take deep breaths, left and right turn, up and down, running in place, and then wait 1 minute and just spray and see if you can get anything during all that moving. So with the running in place, there is an alternative if somebody cannot run. We ask them to bend over kind of as far as they can, touch their legs, because it's going to make for their lungs to feel tight. They can start to create heavy breathing. So you can bend over, touch your legs, and do it like this. It's very difficult to do the test like this. What I will do is, instead of having them bend over so that this is facing down, I will physically turn this sideways so that I can sit sideways, stick the tube into the side here. So they're bending in sideways, and then I spray it. I've only had to do this on a couple people that cannot physically run. So that is the test. Now the post-op test. So when they're, or not the post-op test, excuse me, when they're done, they get their mask. They can't wear it until they're when they're told so. So they get this mask. We're trying to give them a mask, one for each day of the week. Each mask can be worn up to 5 times, but there has to be a 48-hour wait between each use. So if you get this mask on Monday and you're done with it by 6 p.m., you can't wear it until Wednesday, because that's day 3. So Monday, 6 p.m., Tuesday, Wednesday, 6 p.m. So you can't wear it till almost Thursday. So we just tell the students to just mark the date for each time that they've used, put it back in the bag, and then save it. After 5 uses, throw it in the trash. And then we will work out a system of how to get them their new mask there. So I believe that should cover everything. The cleanup is I wipe everything down in here. I take this apart because it just kind of folds out. This folds together. You can fold it over the plastic here. It folds down pretty nicely. And then I clean out all these tubes here. And like I said, make sure, and I sometimes like to keep this little piece that cleans out that little hole. Like I said, when it gets tough, I keep that kind of shoved in there because it helps me so I can, when I need to use it. If we have running low of this, Marisol has some backups, which should be up in that little cubby like we've talked about. And then, yeah, I think that should cover it. Like I said, we have these two Markite masks. We have other additional ones up there, which are different styles, and we should be getting more. When I give them this, I normally put it in a bag to keep it safe. So hopefully that answers a lot of your questions. Please let me know if you need anything else. I will also send you guys some pictures from this book, so if you want to read it before you do so. And then I'm obviously happy to help. So please let me know if you have any questions. Thank you so much, and I hope that wasn't too obnoxious.